may cause drowsiness,
may cause dizziness,
may cause confusion.
Do not drive while taking this drug.
Prescription drugs come with many warnings. Here's another one, may cause DUI. That's because certain medications can impair your ability to drive as much as alcohol. In Delaware, if you're driving under the influence of prescription drugs, you can be charged with a DUI and face the same consequences as an impaired driver. So follow the warnings on your prescription bottle and arrive alive.
Brought to you by the Delaware Office of Highway Safety.
Use of illicit or misuse of prescription drugs makes driving a vehicle unsafe. It can lead to injury or death of drivers and pedestrians. The Delaware Office of Highway Safety is committed to reducing the number of impaired drivers in Delaware by working with law enforcement, community partners, and organizations like Open Door to make a difference on our roadways. We recognize how important it is to properly dispose of prescription drugs so they don't fall into the wrong hands. Our message and focus is simple: don't drive impaired.
Delaware, like the rest of the nation, is experiencing an opiate epidemic. In 2009 was the first year where we saw that more people were dying from drug-related overdoses in our state than motor vehicle accidents. Since that time, we have seen more than a doubling of Delawareans who are dying every year secondary to drug-related overdoses. And Delaware tends to be a state where we have higher opiate prescribing as well. So we prescribe higher amounts of high-dose opiates and long-acting opiates. And in general, we prescribe more opiates than many other states in Delaware. Protecting our water supply is very important, and we all must do our part to protect our drinking water. So it's really important that we get rid of medications in a safe way.
We want to empower patients to get pain relief when they need it, but also to understand the significant risk these drugs represent. The decision to use opioids should be made by a patient and their healthcare provider after careful consideration of the risks, benefits, and alternatives. When they are used, we want to encourage the lowest dose and shortest course that gives relief. Remember also that zero pain is not the goal. Rather, the goal is to relieve enough pain to allow rest, healing, recovery, and improved function. If you have chronic pain, consider ways to manage your pain that do not include opioids such as physical therapy, exercise, non-opioid medications, and cognitive behavioral therapy.
Our prescribing habits are a concern because, first of all, we still have most of those overdose-related deaths are related to prescription drugs. But also, more than 80% of individuals who use heroin started by using prescription opiates.
My name is Stephanie. I've been in recovery for about 4 years now. I first started using drugs when I was 18. I was introduced to Percocet when I was 19 in the ER. I was sent home with a prescription of Percocet for a stomach ache. My Percocet addiction continued on for a few years, and then it turned to IV heroin use. Recovery is possible if we can stay clean, have faith, and take it one day at a time.
Medication safety starts with you. We can all do our parts to prevent misuse of prescription drugs by engaging in safe medication practices at home, as well as educating others in our community. Here are some points to remember. Only use prescription medication as directed by a healthcare professional. Follow the dosing instructions as prescribed by a healthcare professional. These instructions are intentional and help to avoid negative effect. Talk with your pharmacist or your prescriber if you feel medication needs to be adjusted. Do not share or take someone else's medication.
Unwanted prescription medication should never be dumped into your toilet, but instead drop them off in one of our drop boxes. We are accepting any medication that is expired or unwanted, and you can drop it off in our lobby.
Hello,
I'm Corporal Tracy Duffy with the Newcastle County Division of Police. Our prescription drug drop boxes are located in our lobby. They're accessible 24 hours a day, 7 days a week. You can drop off any of your unwanted prescription medication and also medication for your pets. We want to keep our children safe, and we also want to protect our waterways. So drop off your unwanted or expired medication in one of our drop boxes.
The DTERA drug deactivation system is an effective solution in reducing drug abuse, misuse, and environmental impact. As you just saw on your screen, there are a number of locations statewide to drop unused and unwanted prescription medications. However, if you are unable to make it to a Dropbox locations, this disposal pouch will neutralize substances, making it safe to throw them away in the garbage in 3 easy steps. 1. Place medications in pouch. 2. Fill halfway with warm tap water, wait 30 seconds. 3. Seal and gently shake your pouch before disposing in your normal trash.
Follow Count It, Lock It, Drop It's 3-step plan for drug abuse prevention. 1. Count your pills every 2 weeks. 2. Lock and store your prescription in a place others wouldn't think to look. And 3. Drop off unused or expired medications for proper disposal at participating law enforcement departments.